Have you ever felt that burning, tingling, or numbness in your feet or hands, and wondered if there's something simple you can do at home to calm it down, without relying on pills every day? Because what if just a few gentle movements, done consistently, could actually help your nerves feel better, improve circulation, and bring back some comfort to your daily life? Today, we're going to walk through 4 powerful, science-backed exercises for neuropathy that you can safely do at home. No expensive equipment, no complicated routines, just simple movements that can make a real difference if you stay consistent. Now, before we jump in, let's quickly understand what's happening in your body. Neuropathy is basically when your nerves are damaged or not working properly. That's why you might feel tingling, numbness, burning, or even sharp pain, especially in your feet and hands. One of the biggest reasons this gets worse over time is poor blood flow and lack of nerve stimulation. And here's the good news. Movement is one of the most natural ways to wake those nerves back up. When you move the right way, you improve circulation, deliver oxygen to your nerves, and gently remind your brain how your body should feel. So let's get into the first exercise, and don't worry, these are very beginner friendly. Imagine you're sitting comfortably in a chair. Your back is straight, your feet are flat on the ground. Now slowly lift your toes upward while keeping your heels on the floor. Hold for a second, and then gently press your toes back down. This is called a toe raise and press, and it might look simple, but it's incredibly powerful. As you lift your toes, you're activating the small muscles in your feet and improving blood flow to the nerves that often get neglected. Do this slowly, about 10 to 15 times. You might feel a slight stretch or even mild tingling, and that's okay. That's your nerves waking up. Now take a deep breath and relax your feet. Let's move to the second exercise. This one focuses on ankle movement, which is key for circulation. Lift one foot slightly off the ground and start rotating your ankle in a circular motion. Slow circles, controlled movement. Do about 10 circles in one direction and then switch directions. What this does is improve joint mobility and helps pump blood back towards your heart. That increased circulation can help reduce that heavy, numb feeling many people experience. Then switch to the other foot and repeat Sybil, right? But here's the thing. These small movements, when done daily, can add up to big improvements. Now, before we move on to the next exercise, take a moment. If you're finding this helpful so far, make sure to subscribe to Dr. Waterling Hub for more simple, practical health tips like this. It really helps you stay informed and take control of your health naturally. All right, let's continue. The third exercise is one of my favorites because it combines movement with sensory stimulation. It's called the towel scrunch. Place a small towel flat on the floor. Now put your foot on top of it. Using just your toes, try to grab and pull the towel towards you, like you're scrunching it up. At first, this might feel awkward or even difficult. That's completely normal. Neuropathy often weakens the connection between your brain and your muscles, especially in your feet. But this exercise helps rebuild that connection. Do this for about 30 seconds to a minute, then switch feet. Over time, you may notice better control, less stiffness, and even improved balance. Now let's move into the fourth and final exercise, and this one is incredibly calming. It's a gentle foot massage combined with rolling. Take a small ball, like a tennis ball or even a water bottle, plie it under your foot and slowly roll it back and forth. Focus on the arch, the heel, and the ball of your foot. What you're doing here is stimulating the nerve endings directly. This can help reduce pain signals and promote relaxation. Think of it like giving your nerves a gentle wake-up call. But in a soothing way, do this for about 1 to 2 minutes on each foot. And here's a tip. If you want extra relief, you can use a cold water bottle for a cooling effect or a warm one for relaxation. Now let's pause for a second. You might be thinking, can something this simple really help? And the honest answer is yes, but only if you stay consistent. These exercises are not a one-time fix. They're a daily habit, just like brushing your teeth. Small effort, done regularly, leads to long-term results. Even 10 minutes a day can make a difference over time. Now, I want to quickly mention something important. This content is for educational purposes only and not medical advice. If your symptoms are severe or getting worse, it's always best to consult with a healthcare professional. But for many people, combining proper care with simple exercises like these can be a powerful step toward relief. Also, remember, movement is just one part of the puzzle. Staying hydrated, managing blood sugar levels, eating a balanced diet, and avoiding smoking all play a role in nerve health. Your body works as a system, and when you support it holistically, you give yourself the best chance to feel better. Now imagine this, waking up in the morning, placing your feet on the ground, and instead of that sharp tingling or numbness, you feel more control, more comfort. It doesn't happen overnight, but with small, consistent steps, it can happen. Before we wrap up, let's quickly recap. Toe raises to activate your foot muscles, ankle circles to boost circulation, towel scrunches to rebuild nerve connection, and foot rolling to stimulate and relax your nerves. 4 simple exercises. No pills. No complicated routines, just you taking control of your health. And if you made it this far, you're already doing something powerful, you're learning, and that's the first step to healing, so keep going. And don't forget, make sure to subscribe to Dr. Waterling Hub for more easy to follow health tips that can truly make a difference in your daily life. Because your health isn't just about living longer, it's about living better. And before you go, there are a few small adjustments you can make in your daily routine that can quietly support everything we talked about today. For example, try not to stay in one position for too long. If you're sitting for extended periods, watching TV, working, or even traveling, your blood flow slows down, especially to your lower body. So every 30 to 45 minutes, gently move your feet, stand up, or walk around for a minute or two. It may not seem like much, but to your nerves, it's a big deal. Also, pay attention to your footwear. Tight shoes can restrict circulation and put extra pressure on already sensitive nerves. On the other hand, overly loose footwear can affect your balance. So aim for something comfortable, supportive, and well-fitted. Your feet carry you all day. They deserve that care. Another helpful habit is checking your feet regularly. If you have neuropathy, especially in the feet, you might not always feel small cuts, blisters, or irritation. So just take a moment each day to look for any changes. This simple step can prevent small issues from turning into bigger problems. Now here's something many people overlook. Hydration. Your nerves rely on proper fluid balance to function well. Even mild dehydration can affect how your body sends signals. So make sure you're drinking enough water throughout the day. It's one of the simplest things you can do, yet one of the most powerful. And if you want to go one step further, consider adding gentle walking into your routine. Even 10 to 15 minutes a day can improve circulation, strengthen muscles, and support overall nerve health. You don't need to rush or push yourself. Just move at a comfortable pace. Think of it as giving your body a daily message. We're still active. We're still strong. Now, let's talk about patience. One of the hardest parts of dealing with neuropathy is that progress can feel slow. You might not notice big changes in a day or even a week. But that doesn't mean nothing is happening. Your body is always adapting, always trying to repair and improve. These exercises, these habits, they're like gentle signals telling your body to keep going in the right direction. So don't give up too soon. Stick with it for a few weeks, stay consistent, and give your body the time it needs. And remember, even small improvements matter. Less tingling, slightly better balance. A little more comfort when walking. These are all signs that you're moving in the right direction. Now, if you've been following along with the exercises today, take a moment to notice how your feet or hands feel right now. Maybe a little warmer, a bit more awake. That's a good sign. Before we close, I want to remind you again, this content is for educational purposes only and not medical advice. Everyone's body is different, and if you have underlying conditions like diabetes or severe nerve damage, it's important to work with a healthcare provider for a personalized plan. But alongside proper medical care, these simple daily movements can be a powerful addition to your routine. And if you found this video helpful, even in a small way, make sure to subscribe to Dr. Waterling Hub for more easy, practical health tips that you can use in your everyday life. We're here to make health simple, clear, and actionable, without overwhelming you, because at the end of the day, real health isn't about doing something extreme. It's about doing small things consistently, so start today. Pick 1 or 2 of these exercises. Do them gently and build from there. Your future self will thank you for it. Take care of your body, stay consistent, and I'll see you in the next video.